Great. Well, welcome everybody to our webcast, our Quality Reviews webcast. My name is Ed Shin. I am the CEO, co-founder of Quality Reviews. Very briefly, we do real-time patient feedback for health systems, and it is my distinct pleasure to welcome Dr. Sachin Jain to our webcast. So great to have you. Dr. Jain is the new CEO of Scan Group and Scan Health based in Southern California. So welcome, Sachin. It's so great to have you. I've been looking forward to this for the last few weeks, so welcome.
Thanks so much, Ed. We're really great to be here and really excited to be joining your show.
Awesome. Well, first of all, for those of us who don't know you, I mean, if you could just walk through your background. I mean, you're an extremely young CEO of a major health organization, and we're just curious, how did you get to where you're at right now?
I had a lot of great mentors, a lot of great people supporting me along the way. I grew up in northern New Jersey, Indian American, first of my parents' kids to be born in this country. We were just trying to figure our way out around the world. My father's a physician, pain management physician, started the pain service at Memorial Sloan Kettering Cancer Center. And I got interested in issues around health equity and social justice as a young kid. I think probably one of the most seminal things that I remember was growing up around the AIDS epidemic and recognizing that there was such an uneven distribution of how healthcare is delivered in this country, and feeling like I wanted to be a part of the solution to that, but not necessarily knowing how. In college, I had a number of just tremendous mentors, probably the most prominent of which is Don Berwick, who kind of showed me the way, showed me the path to a career where I could start to try to make a difference, both on a patient-to-patient level, but as well as from a more systemic perspective. And so went to medical school, then went to business school in between my third and fourth year of medical school. This was kind of before that was a popular or common thing, and thought I was going to be an academic who bridged the world of medicine and business. Was apprenticed to Michael Porter as he got started working in healthcare, and then was in residency, and President Obama was elected. And I had always wanted to work on healthcare reform. That was a dream and passion of mine. And a number of my kind of mentors, including Don and David Blumenthal, were on their way down to the work in the Obama administration. So I said, "Can I carry your bags for you?" And David actually said yes, and so I went to the Office of the National Coordinator for Health IT, where I spent a year, and then I spent a year subsequently, actually as part of the founding team at CMMI, where I led the team build there, and worked with Rick Gilfillan when he was the first director of the center, and was also a senior advisor to Berwick when he was administrator of CMS. Then I had to come finish my residency, so I went back to Boston, was finishing my residency at Brigham and Women's Hospital. And I think one of the challenges of having worked in government and kind of operating at that large stage is that everything feels small afterwards. And so I was looking for a place where I could make a big impact, and was recruited to Merck actually to lead digital health for the company globally. And it was an odd choice for a Boston-trained physician. In Boston, you're kind of trained to believe that pharma is evil, but had a really tremendous experience at Merck. But my passion was always really on the care delivery innovation side. And, October 2014, got a phone call from a friend saying, "Hey, would you ever move to California?" I said, "Absolutely not." And then I said, "What's the organization?" And he said it was CareMore. And I had been interested in CareMore ever since my time in government, because it was seen as a model that would really improve quality of care and reduce costs. And went out to Southern California and didn't fall in love with California, but did fall in love with CareMore, and had a tremendous 5.5-year run there where we grew the organization from operations in 4 states to 12 states. We acquired Aspire Health, integrated that onto the platform. We had clinical presence in 32 states, and grew from serving 80,000 patients to over 150,000. So it was a really kind of just a really fun journey. But got this call in February about whether I might be interested in leading Scan Group and Health Plan. And Scan is just an incredible organization with a real passion around, I think, the issues that matter most right now: social determinants of health. Trying to simplify and organize a really great patient experience for seniors, and with real ambitions to grow and diversify. And so When I got the call, I listened, and it was hard to step away from CareMore and Aspire, but we're actually very close partners with CareMore. So, I'm not going very far from, my old home, but very thrilled to now be, leading Scan. Very weird to be leading Scan, in the middle of a global pandemic. Switching jobs in the middle of a pandemic is something, quite remarkable, actually. It's been a great couple of months so far. So.
Right. And your office hasn't changed, right? The CareMore office and your office and Scan's office, it's all the same, right?
It's all the same. That's true. It's true. Actually, I'm going into so Edward, I'm actually going into the office every day.
Oh, you are? Okay.
Yeah, I am. And it's, I'm going into the office because there's, you can Zoom with as many people as you want, but there's literally nothing like sitting across a table from someone. And so I have a big conference table, we sit at 8 feet, distance from each other, but I'm at least meeting my team. And I think it makes all the difference in the world. So.
Cool. Awesome. And by the way, please feel free to call me Ed. So yeah.
Absolutely. All right. Sure.
So let's talk about race and racism a little bit. When we first had the initial call between you and I, when I just got to introduce myself, you told me that during college, unlike most pre-med people, you actually took some race relations and, majored in race relations and, talk to me about that. That's I did the typical biology pre-med. What spurred you to think about race that early on in your kind of education, and how does that apply to what's going on today?